How might pregnancy affect a presentation of Lyme disease? I'd like to answer this question as part of a pre-quiz. Then I'll present the case, and then you can try your luck at how you do on a series of quizzes. So let's begin. This case was published by Pavia in 2018. What they were addressing is a 23-year-old woman who had a postpartum presentation. That is, 3 days after delivery, she had bilateral knee swelling and pain. She had similar knee pain during the 6th month of pregnancy. Likely this was a synovitis, which is a common presentation in Lyme disease, where the soft tissue and the synovial sac gets inflamed, although some patients with Lyme have pain, but not the synovial fluid. In this case, she had visited an endemic area in upstate New York, but didn't have a tick, didn't have a rash. The test just happened to be positive with 9 out of 10 IgG bands. This is what the CDC advises for a diagnosis. Many of my patients don't get this many bands, but they don't get written up in a journal. I just have to use clinical judgment. Now, the treatment was 3 weeks of doxycycline, resolved the symptoms, a healthy baby. Now, here's the questions that come up. Is that Lyme disease during pregnancy can be asymptomatic or at least have minimal symptoms. In this case, the symptoms were likely suppressed due to an overactive immune situation with There's several key discussion questions that come up. This patient was relatively asymptomatic during the pregnancy. This happens in patients because the hormones, estrogen, suppress the immune system, allows patients to have autoimmune diseases that are tolerable, but it also reduces the symptoms of Lyme disease in some patients. And second thing that came up was that they said there was no congenital Lyme disease, but they didn't follow patients very long. Also, kids of this age can't present with brain fog and fatigue and a lot of the other issues that one might use. So with time, I always be aware if the mother had exposure to Lyme to be on the lookout. And also, there's a question of should the child be treated? I don't think that's really been addressed, but it comes up in clinical practice. The next question is that diagnosis in this case was based on a clinical history to choose to do the blood test and to go ahead with treatment. The treatment was doxycycline. The doctors or authors didn't discuss some of the alternative treatments available, didn't discuss if there was a possibility of a co-infection, for example, Babesia. The conclusion was that, by the authors, was that it's important to have high suspicion for Lyme disease in postpartum patients with joint symptoms instead of just dismissing it as postpartum. And Lyme disease can be asymptomatic during pregnancy, but manifest postpartum. So the reference was Pavia in 2018. So I'm going to have you try your luck at answering a number of questions based on this case. So what were the primary symptoms reported by the patient postpartum? In this case, it was knee swelling and pain. Fatigue and dizziness was not discussed, although many of the patients I take care of will often have fatigue, dizziness, visual disturbance, and joint stiffness as part of their immune response to the Lyme. Where did the patient likely get exposed to Lyme disease? In this case, she was exposed in a wooded area, but there are ticks in other locations, including in her home in Brooklyn, or at least in many areas in Brooklyn and Queens. There's also Lyme disease with different species, as well as our American species in Europe. Did the patient recall a tick bite or erythema migrans rash? No, and that makes it more challenging to diagnose Lyme in a pregnant woman if they don't have either of these findings. How was Lyme disease confirmed in the patient? In this case, it was a positive Western blot. I have patients where I have to use a positive ELISA as a start, but most important, I have to use clinical judgment. A negative Western blot, but a high suspicion of Lyme disease is something that I regularly have to face in my practice. How is the patient treated for Lyme disease? She was treated with 3 weeks of doxycycline. Now that's a concern if she was breastfeeding, because doxycycline can get in the breast tissue, and there's always concern of how much exposure to avoid coloring of the teeth. There's also the question of whether doxycycline takes care of babesia, which is in a tick. Other treatments are available. What was the outcome for the mother after treatment? In this case, the symptoms resolved after 3 weeks. Now, at least 1 out of 3 patients in some of the earlier studies had chronic issues. This, of course, is before the understanding of co-infections like babesia. How did the Lyme patient affect the newborn? In this case, the newborn remained asymptomatic. Now, there are rare cases where kids are sick after a delivery and they're not sure if it's connected to the woman's pregnancy. There are newborns that show mild symptoms. There's newborns that develop the babesia that have been in the literature. But in this case, it was asymptomatic. But as I said, over time, it's still important to make decisions on whether the child would present with Lyme disease. And what does this case suggest about Lyme disease during the pregnancy? Lyme disease can be asymptomatic during pregnancy and manifest postpartum. Now, pregnancy itself doesn't provide the immunity. That's C. Lyme disease always leads to transmission? No, because I have people who have been bit by tick. I prefer to treat during the pregnancy if someone has a tick. I don't like this one-day treatment protocol because that has only been shown to prevent rashes, not to prevent Lyme disease itself. So thank you very much for listening and participating in this Common Sense Lyme series with the case and your time with me addressing these quiz questions. So if you have any comments, feel free to leave those below. And thank you for joining me. Have a good day.